Okay, so welcome to this short video where I talk about anatomy and just an introduction to anatomy, what you will study in anatomy. Okay, so the word anatomy comes from the Greek word anatomion, which means to cut. So anatomy is basically the study of structure. So anatomy is the study of structure. And in anatomy, so basically for us in medicine, we are most concerned with the study of human anatomy. Okay, so anatomy is studied in three sections. So the first section is when we study the gross structure. So gross anatomy. So with gross anatomy, we are basically studying the macroscopic. Okay, so things that you can actually see with your naked eye. Okay, so structures like the tendons, the bones, the nerves, right? Brain tissue, the intestines. So that is gross anatomy, right? Then this gross anatomy is then subdivided into regions. So the human body is then be divided into the following regions. So as you study them, the first one is your upper limb. So the first one is the upper limb. So here we're studying the shoulder in layman, the shoulder, the arms and the hands. So that is the upper limb. Okay. Then from there you study thorax. Right. You study thorax. And then from thorax you then study the abdomen. Right? Then from the abdomen we study the pelvis. And perineum, the pelvis and the perineum. And then from there we study the lower limb. Right, we study the lower limb. And then from the lower limb we study the head and neck. Head and neck. Then from head and neck, lastly, we then study neuroanatomy. So that's the brain and the spinal cord, neuroanatomy. Okay. So exactly like that. So you have the following regions. 1, 2, 3, 4, 5, 6, 7 regions. And after you're done with your 7 regions, then you write your final exam, right? So in each of these, you'll be writing the end of region exam. So you have an end of region exam for upper limb, end of region exam for thorax, for abdomen, for pelvis and perineum, for lower limb, for head and neck, and your anatomy. And all those marks that you have, then make an average mark. Okay, so they'll make an average mark, which is termed your CA. Right? So which is termed your CA, right? Then your CA plus your professional exam, so your prof exam, right? Mark, right? So this is your prof exam mark, right? So CA plus the prof exam mark then contribute to your final mark. Okay. Contribute to the final mark. So these are the regions that you then study. Okay. So in these regions, so like I said, you study the gross anatomy, right? Then anatomy in all these regions, you also be doing the following as well. You also be studying the histology. So you study the histology. So this is microscopy, things you cannot see with your naked eye. So you study things at microscopic level, cell, tissue, right? You also study the embryology. So development, right? So histology and development, right? So embryology is basically the study of how an organism, for in our case a human, it develops from fertilization, and we go even before that to gametogenesis up to the final term, right? So histology, microscopy, embryology, development, right? So these are studied in all of these regions as well, right? So you have development of the limbs studied, right? Development of the brain studied. You have histology of the brain studied. You have histology of the things that you find in the thorax, so organs in the thorax, for example, the heart, the lungs. You study their histology. You study their embryology as well, right? So this is basically what you should expect. So you do these in the course of your 2 years if you're in the biomedical sciences program. So you do all this, right? And then if you're studying, if your program, you are in allied health, you're nursing science, physiotherapy, paramedics generally, you do these, right? You do these in gross anatomy, and then for your embryology, you'll be focusing mostly from week number 1 to week number 3. So you'll be focusing from week number 1 to week number 3. Then in your histology, you focus on what you call the basic histology. So you do basic histology